As the tornado came across, it literally, everything exploded into the building. If you actually look at all the walls, there's mud and debris everywhere sprayed inside there. That's followed by shrapnel and all this lumber and debris, metal, steel, telephone poles, all just splattered inside the building.
I actually didn't get to my office till about 1 o'clock Monday morning. I went to the makeshift triage center at Memorial Hall in Joplin and did what I could to help there with many of my other colleagues. And after I left there, I went by my office, and it was unbelievable. Dental office across the street was damaged as well. Nursing home a block away, pretty much leveled. They lost several of their residents. And within a few blocks from where we are located, actually by St. John's Hospital, is probably where the majority of the medical offices are that sustain the most damage. The destruction has been immense.
After 50 years.
I had access to my medical records less than 72 hours after the tornado blew our office away. So I am obviously a very big supporter of having electronic health record. John Metazity and his staff were actually able to get our own servers up and running, so that was nice. Probably took less time than having to recover the data from the offsite backup.
We are Family Healthcare Centers of Joplin's IT services. We provide all their IT services, which means server or support for all of their servers, their EMR applications, their backups, their firewall security, anything that's basically electronic, we actually take care of it. So what we do is differently. We actually put servers in your building that are backing up your servers every 15 minutes. So that creates another copy actually inside of your building of your data. In addition to that, we also send that data offsite to 2 different locations. So at any given instance in time, I have 4 copies of your data. I have 1 on your server, 1 on our server that is in your building, and 2 replicas of that data as of the last 15 minutes in the offsite location. So, we believe in, belts and suspenders. You need multiple layers of security. We lost probably about 20 physician offices, and we had every physician office up by Thursday at 5 p.m. whether they had a building or not. They could get to their servers, they could access all their information, all their patient records. They were able to run all their month end because Memorial Day was that time, so they had to get all of their billing in. They were able to do all of that by Thursday at 5 p.m. 100% recovered.
The building was damaged, but it's just a building. This is what we do. So where we do it doesn't really make a whole lot of difference. I was very fortunate. I volunteer for an organization called Life Choices, and they have a satellite clinic in Joplin as well where I volunteer, and they very graciously offered the space to Dr. Croy and myself. So we were actually able to set up shop and start seeing patients 2 days after the tornado. Just because a tornado wiped out a significant portion of our community, the patient needs don't change. I still had people calling needing their medicine. People were calling because they were injured. They still needed to be taken care of. When I walk into the room, I can give them a hug and tell them how sorry I am for their loss, and I can listen to them, and I don't have to ask them 1,000 questions about their history that I already have but might not have had access to. I didn't have access to those records when the pharmacies are calling me asking for medications for patients. Like I said, there were many. One of our Walmarts here in town was destroyed. Well, and you know how many people go to Walmart to get their prescriptions filled. So Other pharmacies are calling me. We have so-and-so here at our, in our office. They've never filled prescriptions here. They don't know, they think they know the names, but they don't know the doses. They don't know the directions. Well, guess what? I would have been just as lost as the patients under those circumstances. At this point, there really is no reason why you should be afraid of electronic health record. Privacy concerns, obviously, my patients' records, safe on servers and off-site backup versus paper chart 75 miles away. So there is no comparison.